afternoon, everyone. I want to start by thanking everyone who is on this call today for every single thing that you do every day, providing critical services and supports, but also advocacy for our Social Security beneficiaries. When I think about your work, I actually think about a quote by Hubert Humphrey, and to paraphrase him a little bit, he believed in part that the moral test of what we do is based on how we treat those who are in the dawn of life, our children, how we treat those who are in the twilight of life, the elderly, and those who are in the shadows of life, the sick and the needy. And as my time in the Obama administration is coming into a really rapid end, I'm so full of gratitude for all that we've done together over the years. Thank you all so very much for your friendship, your guidance, and your support. It has been quite an honor to serve with you, and it's one that I will never forget. Today I'm going to briefly as possible, cover a few things, talk about the importance of Social Security, ways we are working to increase awareness about our many benefits, but also, importantly, how we are working to increase access to those benefits. And I'm glad Kathy Holt made the point earlier that so many people in this particular constituency are low income. We're also going to discuss some tools and resources that we have available to help you serve people, but also we'll discuss some partnership opportunities. And I'm really glad and pleased that my great colleague Robert Path is on the phone, and he'll provide some great information about some of our employment supports and other partnership opportunities as well. So first, I want to note that Social Security is there for people during times of hardship, transition, and uncertainty. Our programs are really a vital financial protection for workers, children, people with disabilities, and people who are older. In fact, there is some data from the U.S. Census Bureau that showed that Social Security is by far our nation's most effective anti-poverty program. Without our programs, so many people that you serve every day would find themselves living in poverty or would perhaps be homeless. And as Americans are aging rapidly and at historic rates, but also becoming more prone for disability, it's really critical that our agency, SSA, collaborates with the SHIPs and others in the aging network to raise awareness about our various programs and supports and services, but also we do all we can to increase access to our benefits and find people who might be missing out on benefits and make sure that they receive them. And this advisory group has been such a wonderful opportunity and an honor for me to serve with, and I want to thank them for everything that they did to raise awareness about our disability or SSDI program. You know, disability is so unpredictable and can happen to anyone at any age. How many of us know a younger person who's been in a really bad accident or who may have cancer or a mental illness? And for 20-year-olds who are insured by disability benefits, more than 1 in 4 of them will become disabled before reaching retirement age. So this is a absolute economic lifeline for millions of Americans. People like Lynn, one of our beneficiaries with cancer, she said that without the Social Security, her life would be a horror story. She'd have to scramble for her basic needs and might be living on the streets. She said that she'd be a lot sicker if it weren't for her benefits, and she honestly doesn't know how she would provide for herself. And as critical as this program is, there are some common misconceptions about the program and the people who are relying on this program. So we really need your help in the aging network and among the SHIPs to raise awareness about the program, to make sure that people understand the benefits, understand the program, and have a really clear-eyed view of the people who are relying on this program, really to keep them out of poverty. These are really some of our nation's most vulnerable people, and as one measure of how severe their disabling conditions are, nearly 1 in 5 men and 1 in 6 women actually die within 5 years of entering the program. I also ask, in addition to help us raise awareness about SSDI and the benefits and our beneficiaries who rely on the program, that you help us raise awareness about how important health insurance coverage is for this particular constituency. People who are on SSDI are eligible for Medicare, but this is only after a 24-month waiting period. And there are currently about, I believe, 1.8 million or so people who are caught in this waiting period, and they often don't have any health care coverage, even though they have these very severe conditions. We did a major study that found health insurance is absolutely critical for these beneficiaries who are waiting for Medicare. Our study showed that those who availed themselves of health insurance while they were waiting had a much better chance of receiving diagnostic tests, addressing unmet medical needs, and experiencing better health and economic outcomes across the board before they got on to Medicare. So to help us spread the word about SSDI, please visit our Facts and Faces of Disability webpage on our website. We have free tools and resources available to you to help talk about this program, to raise awareness about the program, but also to reach some of the beneficiaries. We can provide you with sample presentations, fact sheets, posters, graphics, social media tools, and videos that you can use in your community events and in your social media efforts. Another very critical program is SSI, and this is another critical lifeline for so many people, providing income supports to people who are disabled, who are blind, and who are older and have very low income and limited assets. Parents are very modest, but the majority of adults on SSI rely on it for at least half of their income, and more than a third of them rely on it for just about all of their income. I spend a lot of time talking about SSI because so many people who are on SSI can also, or qualify for SSI, can also qualify for other social services and support such as Medicaid and SNAP. These collective benefits can make all the difference in the world for someone who's struggling to pay rent or provide hot meals at night for their families. A challenge that we are having, especially among more older people, is that there is a significant population of older people who potentially qualifies for SSI, but don't receive the benefits. So we need your help again to raise awareness about the need for SSI and to make sure that people who qualify for it receive it, because they're not just missing out on SSI usually, they're also missing out on so many other benefits that SSI could be a trigger for. We're also working really hard to streamline our applications and in participating states by using information from our SSI applications to automatically generate a SNAP application. The application is then forwarded to SNAP where they determine eligibility. We don't want the complexity of the process of applying for benefits to be a barrier for this very vulnerable population. There are many things that we're doing internally to increase access to benefits for our beneficiaries who need them the most. We find situations where folks may be missing out on benefits, and when we do things like simplify policies and improve our overall business processes. We do targeted mailings and perform other types of outreach to find these beneficiaries, but also to inform them about higher or additional benefits that they may qualify for. When you are working with our beneficiaries who you believe may be missing out on benefits or may be qualified for a higher benefit, please work with us. Please let us know. We really want to make sure that every single beneficiary of ours gets every single benefit they deserve, need, and qualify for. To help us in this effort, we have a free resource on our website called our Benefit Eligibility Screening Tool that helps you find out if folks could get SSA benefits. Based on answers to a few short, simple questions, this tool will list benefits they may qualify for, but also give them information on how to apply for the benefits. Our agency is also a very active member of the Center for Benefits Access Federal Advisory Committee, where we work with other federal agencies to improve access to economic security for low-income older adults and people with disabilities. This has allowed us to work much more closely with the SHIPs and other members of the aging network like AAAs and ADRCs and other member grantees around the country. Also, one other way that we are working to streamline things for our beneficiaries to make it easier for them to apply and make it easier for them to receive our services is we are making it easier for states to use SSA data to determine eligibility for benefits like TANF and SNAP through what we have nicknamed our Data Hub. You may have seen a report that was issued in 2010 that estimated 2.3 million people who are eligible for the Medicare low-income subsidy don't receive it. And we know these benefits can make all the difference in the world for beneficiaries struggling to make ends meet. In my particular job, I hear from and about people who have to make really hard choices at night, not able to afford a hot meal and pay for expensive drugs, or able to pay for drugs and provide heat in their homes in the winter. The Medicare low-income subsidy is there for them and can be an absolute life change for a person who needs that additional support. I am so very excited and proud of the work that we've been doing to increase the uptake of the Medicare low-income subsidy. You know that every year every spring we send letters to potential low-income beneficiaries around the country, letting them know about the Medicare low-income subsidy, but also the Medicare state savings programs. Last year we did something really innovative and different. Before the letters went out, we shared with community-based organizations, the SHIPs, the ADRCs, AAAs, and Centers for Benefit Enrollment Centers, zip code level data on the number of letters that we mailed out to each zip code around the country. This allowed many of you to work with us to micro-target outreach efforts within those zip codes, helping the recipients of the letters apply for the subsidies and make them more aware of the benefit of these subsidies, but also, importantly, to let them know that these letters were not a scam. This was a legitimate letter and this is a legitimate benefit. It was a big success, at least from a lot of the anecdotal evidence I've been getting, and we plan to make this part of our business processes in years forward. So even after I have left the agency, hopefully that this will definitely continue. And I don't know if Leslie Freed is on the call today from NCOA, but she was really instrumental in helping us work on this. So Leslie, if you are out there, thank you so very much in NCOA. And speaking of NCOA, we also worked with them to create another map very similar to the LIS map that shows the number of Medicare beneficiaries who are also receiving SSDI, and we've done this zip code by zip code all around the country. So using this interactive map, we can connect you zip code by zip code, let you see zip code by zip code where these beneficiaries are in an effort to perform some outreach and get them connected to some other social services and supports they may qualify for as well. We're also working and taking a holistic look at our communications and our notices that go out to these beneficiaries and making some significant changes in the way that we are describing our programs to help reduce some of the stigma that may be associated with receiving government benefits and being on government assistance programs. So any ideas, best practices on ways that we can talk about programs to reduce stigma that you may have even locally would be really good for us to hear those best practices. I know that more and more of you who I hear from are using technologies to increase access to benefits and to reach people, especially the younger population. So our SSA Express Icon is an absolute must-have. This is a user-friendly piece of technology that is very easy to install. If you have computer labs in your facilities, we can send you a link with an icon that you can download to your computers. The people who you serve who come in to use the labs can click on these icons and access a whole array in the menu of SSA services without ever having to come into one of our field offices. We've been putting these icons on computers in senior centers, assisted living facilities, libraries, social service agencies, area agencies on aging, SHIPs, and others. If you would like to have these icons to put up on the computers in your lab that are available for public access, please let us know. I'll make sure that after the webinar my personal contact information goes out and we can make sure that we can accommodate you. Next slide. One of the more innovative things that we've been doing at SSA is working with the White House Social and Behavioral Sciences team. They're really helping us to reflect our best understanding of human behavior, how people engage with, participate in, and respond to our policies and programs. Their insights have really helped us to improve our outreach efforts and really increase uptake of some of our low-income programs. One of the pilots I want to highlight is our project that provides really helpful information to SSDI applicants whose applications may have been denied. Just because their applications have been denied doesn't mean they still don't have some type of significant need. So we've been providing them with information about other services and supports they may qualify for, such as vocational rehab, healthcare, benefits, and even employment support through the American Job Centers. And that's another way that the SHIPs can really help us when people have been denied for SSDI. If you can help us give them some of this other information that may help them have a better quality of life, that would be really helpful. Next slide. Now I want to briefly talk about one of our agency priorities that's really a personal passion of mine, and it has been for my entire time working in the administration, and that is preventing the financial abuse and exploitation of at-risk adults. Studies show that only 1 in 44 of these cases ever get reported, and financial exploitation can be so deadly because it often co-occurs with other types of abuse. It has serious, long-lasting effects, what we call poly-victimization, and according to our friends at the National Center on Elder Abuse, victims can suffer serious physical health effects and often suffer total financial ruin with little chance of replacing their lost assets. Many often suffer depression and hopelessness, which may even lead to suicide. Since multiple forms of abuse often co-occur, coordination across agencies and sectors is really critical. One of the best ways that we have of doing this at SSA is working around the country with multidisciplinary networks. One such model is the WINGS model. You may not have heard of that, but that stands for the Working Interdisciplinary Networks of Guardianship Stakeholders. These are multidisciplinary prevention networks that help us develop practical responses to financial exploitation and abuse at the very local level. These teams consist of stakeholders from the judicial, legal, aging, disability, guardianship, and mental health networks, as well as including self-advocates. We are currently working with WINGS teams in 17 states, DC, Georgia, Indiana, Minnesota, Mississippi, Missouri, New York, Ohio, Oregon, Texas, Utah, Washington, Wisconsin, West Virginia, North Carolina, Virginia, and Guam. If you are in any of those areas, we welcome you to join our teams and join us in this work. We have tools and training available to help us with these efforts. And those of you who aren't in those states, I really encourage you to join like multidisciplinary teams in the states and cities where you are, or create your own. There are some resources and toolkits that can show you how to create your own multidisciplinary team. We really do need the unique perspectives that the SHIPs and others in the Aging Network provides to this effort. There are a few things that you can do to help us to protect our beneficiaries that you are serving from financial abuse and exploitation. And I've spent a lot of time talking about this because it really is a serious and growing problem. You can remind people to do a few simple things to protect themselves. Never provide personal information when receiving unsolicited calls or contacts, including emails. And never agree to accept prepaid debit cards or credit cards in another person's name. And never agree to wire money to any unknown person. And always contact us at SSA if people are receiving calls from someone who claims to be from the agency, but they are asking for personal information such as a social security number. They really do need to call us and report those. Our Inspector General's website has really good information and resources about the latest scams and other preventive tools and protection tools that you can use to disseminate throughout your networks and make people more aware of some of the scams that we are seeing. Sometimes you may be working with our beneficiaries who are unable to handle their own financial affairs due to maybe a physical or mental challenge. In these cases, we'll appoint a relative, friend, organization, or other party to handle their social security matters, what we call rep payees or representative payees. They are responsible for making sure that our the funds are used for the beneficiaries' basic needs, such as food, shelter, and medical care. Rep payees help provide a safe and stable environment for our most at-risk beneficiaries who need help with decision-making and with financial caregiving. We would like to work with you and your community partners to help to find rep payees for our beneficiaries that you are working with who may need this extra level of support. And also to make sure that our rep payees have the tools they need to perform this very critical duty. In order to better support our rep payees who are doing this particular critical task, we have launched recently a multidisciplinary training that includes modules on the technical aspects of being a rep payee, how to recognize the signs of abuse and financial exploitation, strategies for interacting with the banking community, and also how to recognize changes in adult cognitive decline. These modules are free, available online to all of our rep payees, but also to others who are working with a population that might need a little bit more assistance in decision making or managing their own money. You can go to our website. The link is on this slide. You could use the training in your own kind of community trainings and workshops, but we really want to disseminate this training as a free resource and tool to people out there working for these populations. One of my top priorities since I've been at the agency is making sure that we have good relationships with community organizations organizations who are serving our beneficiaries. We are going to continue to make sure that you have good contacts with our field offices and our regional offices around the country, especially with our public affairs specialists and people who are our regional Medicare coordinators. There is a lot of work that we can do together, and I'm very excited about the possibilities, and we'll make sure that you know who the people are in your area you need to reach out to for more information and resources, or even if you're having events where you want a Social Security employee to come out and speak and provide training, we can do that as resources allow. Over the next few weeks and months, you're going to see a lot more coordination between our agency, and not just with the SHIPs, but also with the senior Medicare patrols around the country. Working together, we can better coordinate our services for our beneficiaries, but also protect their resources. We're also going to be working to raise awareness about the SHIPs and the services that the SHIPs provide to our beneficiaries around the country. We have a network of about 1,200 or so field offices around the country, and we're going to be providing information about the SHIPs so that our beneficiaries know about the great work and services that you can provide to our beneficiaries. We're also working with our IG's office to create a suite of tools and resources and other information about our programs, but also how you can work with us to prevent and report Social Security fraud and abuse and protect our beneficiaries and resources. So you should see some materials and resources and tools coming out to you very soon. I have 2 more slides left, but before I close, I want to make a shameless plug for our My Social Security accounts. I really encourage all of you to get one, and to encourage people that you are working with and serving to get one as well. There are a few things that people can do with an account, such as get a replacement Medicare card, review an estimate of your benefits that you or your family may get in the future, verify your lifetime earnings, and many, many other things. It's really one of the best and free financial planning tools that you will be able to get. So please, please, please today get your very own My Social Security account. In closing, I would like to leave you with a quote by our Acting Commissioner, Carolyn Colvin, and this is something that she told our SSA staff out in our field offices around the country, but it's just as appropriate for me to share with you. She said that, remember, each day thousands and thousands of individuals may experience, even for a small moment, hope, and if we are lucky, a better life because of something you have been able to do for them. Thank you for all that you do.